Governor Hogan recently directed the Maryland Department of Health to begin publishing everything on racial and ethnic breakdowns on COVID-19 cases. The 75% of the currently available data, which he calls troubling disparities, and points to a persistent public health challenge that we must address. In other words, people of African American background are at a much higher percentage of showing infections from this virus and death from this virus. Yes?
Yeah, that's what we saw in the release of the Maryland state data, and we have some preliminary data in Anne Arundel County that we're seeing higher rates of African Americans with testing positive for COVID, but we're still trying to gather the data. It's one of those situations where we're trying to figure out how do we pull the data out of the databases, and so we're hoping to be able to have a better sense of the information that we can share with the public on this. We're looking to pull out the data, but that doesn't really stop us from acknowledging that it is an issue in the county as it is throughout the state. We know that, and we're actually quickly moving towards what we can do to identify what those challenges are, what the gaps are, and then figuring out what it is we need to do to address those health disparities.
And this isn't isolated to just this virus. This is an ongoing issue with many things. I mean, I, as a breast cancer survivor, I know for one that African American women are much slower to be diagnosed with breast cancer, and by the time they are diagnosed, it's more often than not in the later stages. So that's a problem there. With so many things in the medical system, there's an issue with this. Why is that?
That there are a number of reasons for that. Health equity and particularly racial disparities are something we've seen across a variety of, across the entire healthcare system, to be quite honest. There's multiple factors to that. One is systemic racism, just where healthcare is in terms of accessibility, attitudes within healthcare, in healthcare writ large, issues around continuous stress from racism and other societal factors that are disproportionately placed on African American populations. And then there's also just historically there's been issues with the healthcare system and how African Americans have been treated. And when we look at health equity, we talk about race and ethnicity and issues with African Americans, and we also see disparities with other ethnicities. And we also try to look at what the disparities are along income lines. So we also see lower outcomes amongst poorer populations, and sometimes these things overlap as well. So it's a really complex area, which argues for us devoting even more attention to it to make sure that we address it.
Donna Cole, WNAV News.